15 firefighters in 100 days. It's the My Heart Challenge, where the firefighters are participating in a program aimed at improving their heart health, thanks to the Intermountain Heart Institute. And there's some exciting new research coming out of Murray.
Very exciting. Doctors there say they've discovered genetic markers that can help predict when a person suffering from heart disease may have a heart attack.
And joining us live with this exciting news to break it all down for us, Dr. John Carlquist from the Intermountain Medical Center Heart Institute. Yeah, and really, as far as heart disease or heart attacks, it's really been about treatment, not really about prevention.
Exactly. I mean, prevention is clearly becoming the new focus, especially in women's heart.
Well, so tell us about this new discovery and how it works.
Well, we really weren't looking for a marker that predicts a heart attack. We were trying to understand more what goes on prior to a heart attack. I mean, some people develop coronary disease and live forever without a problem. Some people develop coronary disease and have 1 to 2 heart attacks. So we were actually trying to understand what is that process in those people who, ultimately have a heart attack. What are the biological events that are occurring that lead to that heart attack? And we've been collecting samples from individuals with heart disease for about 20 years. And it turns out that just by chance, we had collected samples from about 40 people just prior to having that heart attack. So we had the opportunity to look at those samples, look at the markers that are in that blood specimen and see, is there anything abnormal that kind of gives us a sense of what's happening in that person that's leading to that heart attack.
Just to break it down a little bit further then, I mean, how specific were you, what were you able to attribute it to? And are these men and women involved in this?
They are men and women. This is just basically scratching the surface. And what we're hoping is this will give us some kind of a clue is to look at, where can we go from here? What are will this lead us to understanding or identifying those processes that set people up or put them at risk for a heart attack? And understanding that, then maybe we can develop specific interventions to prevent the heart attack from occurring.
So right now, are you saying then that there's not a way yet to take some sort of a test and see these genetic markers and know that this is what's going to happen to this person, or?
Yeah, I'm not saying that's an impossibility. I mean, with the new developments in nanotechnology, you could even potentially put an app on your phone to monitor yourself to see if you're moving into a danger zone. But I don't think that's really what we're looking at. We're more concerned with what is the process? What is this telling us about what's happening within that individual in the days prior to that heart attack?
All right, pretty exciting stuff here. Appreciate you joining us and sharing some of that information. Dr. John Carlquist with the IMC Heart.